Portia Grigsby. I am the Executive Director of Black Girl Health Foundation. The foundation is geared to improving the health of women of color through engagement, education, and empowerment. And you are here watching I'm Survivor Workshop Series. This is actually our first workshop series, but our second I'm a Survivor campaign. So we're really excited about that. I want to first acknowledge and thank our sponsors. And so that is MD Anderson Cancer Center. And also, I would like to thank Touch. Touch is a Black Breast Cancer Alliance. For both of these organizations help to bring this to fruition, and we thank them so much for supporting our breast cancer event. Before we get into our workshop series, I just want to let everyone know what they can expect. So we have 3 workshops this morning. We have our Mythbuster workshop, and that's where we're going to be debunking myths. We also have our workshop that is going to be targeting holistic health and breast cancer prevention through nutrition. And then we have our I'm a Survivor workshop, where you're going to hear from a survivor of breast cancer. This initiative is really important to us because we know that African American women have a very high rate of breast cancer mortality, and it's not talked about enough. We also know that younger Black women have a very high rate of severe cases of breast cancer when it comes to triple negative breast cancer. So it's really important for us to spread awareness about what people can do to improve their health and to know their bodies. We don't want women to wait until the last minute to get checked. We feel that if you know more about breast cancer and how it affects African American women, yes, African American women, we hope that people will know their bodies, feel their bodies, feel on their bodies, be aware of what's going on so they can be more proactive in their health. So with that said, we're going to get started with the first workshop, but right after the break, so stay with us.
What did it take for me to overcome breast cancer? It took the crucial first step of choosing MD Anderson Cancer Center. It took a unique multi-team approach and a comprehensive treatment plan so personalized that I trusted my doctors with my life. It took a deeper level of expertise to triumph over breast cancer and handle anything that comes my way.
What will we do in the pursuit of making cancer history? Whatever it takes.
All right, well, let's get started with our Mythbuster workshop. Okay, so again, I'm Portia Johnson, and right beside me is Kayla Scott, who's going to be my co-host today and helping me moderate our Mythbuster workshop. Kayla Scott is our college ambassador, and she is from Old Dominion University in Virginia, and she's been working on this breast cancer campaign with us, and we so enjoyed her. Kayla, I'm going to give it to you to just say a few words on how this initiative has impacted you.
It has impacted me because, like you stated, Portia, earlier, this is a huge initiative that Black women really need to hone in on and really need to have that viable information, where sometimes we can be misled or having misinformation. So just having that, accurate information so that we're able to take the necessary steps for our overall well-being of our health, because if we don't take it into our hands, who will? So this has been a great project that I have been a part of, the I'm Survivor, and I am very grateful and thankful for me to be able to learn what I have learned, thus far, and to be able to pass that along to my family and friends, as well as to the community as a whole.
Awesome. Well, let's get right to it, Kayla. Won't we introduce our presenters who are going to be debunking myths?
Exactly. Yes, Miss Portia. So our first presenter would be Miss Ricky Farley. Miss Ricky Farley would be our sponsor for Black Girl Health, for our Black Girl Health Foundation, I'm Survivor program. And we also have Dr. Javita Orrery as well. So those are our two presenters at this moment in time. But I would like to hone in on Miss Ricky Farley at this moment in time. So hello, how are you all?
My dog is barking like a crazy person. I'm gonna go get her. So sorry about that, Harper. Oh, how are you guys today?
Yes, good in you, Miss Farley, good in you. So Miss Ricky Farley is, like I stated, a sponsor for Black Girl Health Foundation Incorporated, and I'm Survivor program. Miss Farley is a triple negative breast cancer survivor and the CEO of Touch Breast Cancer Alliance, the Black Breast Cancer Alliance, which aims to treat Black breast cancer in a distinct disease state. She is the founding member of #Black Data Matters, which was founded in collaboration with breastcancer.org, Citizen, the Center of Healthcare Innovation, and Morehouse School of Medicine, and Stephen G. Coleman Foundation to encourage and elevate the importance of Black women participating in clinical trial research. So that is to Miss Ricky Farley. Thank you, Miss Ricky Farley.
Sorry, my dog is not cooperating. Just to sit in my lap. This is Harper.
Hi, Harper. Hi. And also honing in on our next sponsor, our next presenter as well, Dr. Javita Orrery. Dr. Javita Orrery, hello. Hi.
Hi.
Yes, ma'am. So Dr. Javita Orrery is a board certified surgeon who has specialized in breast surgery for many years. She is particularly interested in treating breast cancer and the breast illness in young and minority women of various ages. She belongs to the American Society of Breast Surgeons in the Mound City Medical Forum, and she is an associate fellow of the American College of Surgeons. She also serves on the boards of the St. Louis Crisis Nursery and Gateway to Hope. That's to Miss Javita Orrery. Thank you so much. Yes, ma'am. So we're going to jump into the Mythbuster questions at this moment in time, and I'm going to pass that back over to Miss Portia at this moment. So I take it to you, Miss Portia.
Okay, Kayla, if you call me Miss Portia one more time, it's gonna be a problem. It's gonna be a problem. No, it's all good. So yeah, let's start separating facts from fiction here. So we're gonna start with the first statement here, and I'm gonna actually send this to Ricky Fairley. So let's pull that up. So Ricky, if none of our family members have breast cancer, you don't really need to worry about it. Is that a fact or is that a myth?
That is a myth. That is a myth. Only about 5% of breast cancers are actually hereditary. You know, with a breast cancer gene, everybody is at risk for breast cancer. Every woman is at risk for breast cancer. And Black women are dying from breast cancer at a 42% higher mortality rate. But everybody needs to get checked. And Black women under 35 are getting breast cancer at twice the rate, dying at 3 times the rate. So young, well before you get your first mammogram. So we all need to be checking our breasts and be aware of breast cancer and take action.
Do you feel that a family history of breast cancer puts you more at risk, though?
Yes, a family history clearly puts you more at risk. And if you do have a family history, you need to, go get a risk assessment with your doctor, and they will look at what we call your her story, and then also do genetic testing to make sure that you don't have a genetic profile. So a genetic history makes you at very high risk for breast cancer, but a family history also does. The one thing that we know is that only about 3% of Black women participate in clinical trial research. And so we don't really know if there are genes that exist for Black women that they haven't discovered yet because we don't have the science. So we are all at risk. There was a study done a couple of years ago that identified that 92% of Black women will say they're aware of breast cancer. 25% will talk about it with their family and friends, but only 17% act on the risk. So we need to be aware, acting on our risk. But we are all at risk. We are all at risk. We should all be checking our breasts as soon as you kind of, I think go through puberty,
Yeah,
Be
absolutely.
aware, know your bodies, know your bodies, know your bodies. You can't know them any better.
Absolutely, absolutely. And ladies and people who are joining us and hearing this, please feel free to comment. And you may want to ask, more additional questions. We'll try to get them, to our presenters, but definitely comment. We want to hear from you. Let's then, Kayla, take on the next question.
Yes. So this question would be for Dr. Orrery at this moment in time. So my question is this fact or myth? Can cell phones, bras, and excessive amounts of sugar cause breast cancer?
So this is a myth. But first, let me just go back to the first question real quick. I agree with everything 100% that Ricky said. Being a woman and getting older are the two most important risk factors for breast cancer. So it doesn't matter anything else you hear. As a woman, yes, you should be checking yourself regularly, and at the start of puberty is the best time to start. And we have to stop the secrecy around talking about our family history, because our family history is so important for us to know what diseases we may be at risk for. So going back to this second myth now, it is false. Bras do not cause breast cancer. Cell phones do not cause breast cancer. And what was the third one you said? Sugars. And sugars do not cause breast cancer. The thing about sugars, and you hear a lot of people say sugar feeds breast cancer. So there's an indirect link. It's not a direct link. Eating excessive sugar can increase your body weight. And we know that the higher your body weight, the higher the risk of breast cancer. So it's an indirect link, but not necessarily the sugar itself that's causing the breast cancer. So we always encourage you to minimize the amount of sugars that you consume, and especially the amount of processed sugars that you consume, just because of the risk of weight gain. And again, weight gain and BMI increasing your risk for breast cancer. But cell phones and bras, no.
Okay. Do you think, like, would you be able to elaborate a little bit further of like what may be the causers of breast cancer at this moment?
So when I talk to my patients, or when I do talks, I always talk about three main reasons that somebody would develop breast cancer. One is hormonal, and that's being a woman. Like we both just said, being a woman increases your risk of breast cancer, so we're all at risk. Number two is genetics. Is there a gene that you were born with that increases your risk of breast cancer, which we know only accounts for about 5% or so of breast cancers? And then the third is environmental. So what do we mean by environmental? It's what you put in your body, the food you're eating, the way you're moving. Are you a smoker? Are you a drinker? What environment do you live in? Are there pollutants? Are there chemicals in your workplace? Those are all factors, and probably attribute to about 40% of breast cancers. These are things that we call modifiable risk factors. These are things that we can actually do something about. So that goes into lifestyle. We can control what we're eating and how much we're getting, and if we're drinking alcohol, if we're smoking, and if we're exercising regularly. Those are things that we can control. Saying that doesn't mean that if you do everything right, you're never going to get breast cancer, but it is one of the things that can increase your risk for breast cancer for sure.
Yes. Thank you for that elaboration, Dr. Orrery. Thank you so much.
You are welcome.
Yes, ma'am. So back to you, Portia.
Thank you. All right, let's go to our next Mythbuster question. All righty, and this is for Miss Ricky Fairley. Black people don't I can't wait for you to address this. Black people don't get breast cancer. Ricky, myth
Do I
or
look black? Do I look black?
That's what I was like. But a lot of people believe that. A lot of people,
It's not true. It's
yeah.
not true. And I'm here right here talking about it. But no, actually, I like to call it black breast cancer. We have our own disease of black breast cancer. Why do I say that? So, 1 in 8 women will get breast cancer overall. Okay. So our incident rate is the same overall as white women. Our mortality rate is 42% higher than white women. Black women who've had breast cancer, like myself, have a 71% higher risk of death. Black women have a 39% higher risk of recurrence of breast cancer than white women. Black women under 35 get breast cancer at twice the rate, so the incidence is significantly higher, and die at 3 times the rate. A lot of that can be attributed to the fact that Black women are 3 times more likely to get triple negative breast cancer. And triple negative breast cancer, and I'll ask Dr. Javita to kind of explain the science, but it's basically how the cancer cell receives treatment, right? One is based on a hormone called estrogen, one is based on progesterone, and one is based on an enzyme or protein called HER2. So if you test negative for those 3 things, it's called triple negative breast cancer. It has the highest mortality rate. It's the most aggressive. And again, Black women get it at 3 times the rate. That's what I had. So we do get breast cancer, and we get it more severely, and we're dying from it in more incredible numbers. So that is totally a myth, and we all need to be careful of it and be wary of it. We're also getting it at younger ages and at later stages of disease. COVID has had a horrible impact on breast cancer for Black women because so many women didn't want to go to the doctor, go get their mammogram, go get checked, or even get treatment. And so I can't even imagine what breast cancer for Black women is going to look like in a year. We're seeing way bigger tumors, and Dr. Javita probably can attest to this, and more advanced stage. The other thing I would add to what Dr. Javita said earlier was that Black women are more likely to have dense breasts. Dense breast means you need to get a 3D mammogram instead, but women with dense breast have a 4 to 5 more likely chance to get breast cancer. I believe my breast cancer was actually caused a lot by stress. And, we are all these powerhouses. We wear the purple cape every day, take care of everybody. I'll give you my last piece of chicken. I'll give you I'll buy you a car and walk. I'll do everything for you as a mom or I'm a helicopter mom. And I believe stress, and I had to learn through my experience that I had to get all of the cancers out of my life, not just the one in my breast. So I did some crazy things and to change my life. I started a new life after breast cancer, but also I had to learn that my peace is non-negotiable. And so is yours. Don't wait till you get sick.
Absolutely. Absolutely. Ricky, I think those were good points. And I don't know if you and probably Dr. Javita can also address this a little bit more. But in your mind, what do you think maybe contributes to the disparities? So we talked about how Black women are, even more at risk for mortality. What is it that's just, contributing to these racial disparities when it comes to being or getting breast cancer? In your mind,
there's a lot of factors, a lot of psychosocial factors, the social determinants of health, access to care, access to quality care. But I believe it's really the science. We don't have the science. We don't, because of the very low participation rate in research. It's only 3% of Black women are participating. So the drugs and therapies that we have right now, we don't have data on Black bodies. We only have data on white bodies. So for me, I did standard of care chemo. I had a double mastectomy. I did the standard of care chemo for breast cancer. I had stage 3A triple negative, and they didn't work. My cancer came back in a year. And so I had to go do some experimental drugs. So Dr. Javita, I did TAC, and then I came back and did carboplatin, gemcitabine, and that's what saved my life. But we don't have any data for Black women on these drugs. And so doctors automatically give you standard of care chemo, what's sort of known for the right thing to do for white women. But guess what? It's not working for Black women. So we need more science. We need more Black women to participate in research. And we need to overcome the fear of research. I mean, clearly there's a lot of earned medical mistrust from Henrietta Lacks and syphilis and all the crap that we know about. But we've done a lot of research. I'm not a scientist or a doctor. I'm a marketing person. And so we've done a lot of research into the emotional factors as to why Black women are afraid of research. And we're now about to start a movement to educate and help women understand how a clinical trial works, how the research process works, and what it takes to to engage in it, and that there's no sugar pill in cancer research. So we're doing a lot of work around helping Black women understand the importance of research and what it means and how to do it. Because until we have this data, we're not going to get drugs that work for our bodies.
Exactly. Those were good points. Dr. Javita, can we pull Dr. Javita up real quick? Because I'm sure that you want to kind of piggyback off of that. And
I
if you
know.
could back off of that, and then we're going to go to the next question for you. But Dr.
Sure.
Javita, can
No.
you say a few words as it relates to, what's causing the kind of the disparities, what's behind the disparities when it comes to the risk of breast cancer?
Of course. No, I was back here saying yes, 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 yes to everything that Ricky was saying. Oh my gosh, we need to have our people participate in clinical research so badly. We do need the science because we know that clearly the biology of some breast cancers is so different in Black people than in white people. And we know this because when we look at triple negative breast cancer, for instance, we see the same triple negative breast cancers in Black women in Western societies that we see in Africa. So there's definitely something biologic, something that we're just not understanding because we don't have enough data. And I know we have such a horrible history with research in Black people in this country, and there's definitely reasons why people should be nervous or afraid to go into research, but a lot of that has changed. For breast cancer in particular, it's important that we participate in these trials because that's the only way we're going to be able to find therapies that work for Black women. A lot of the disparities are really what you said. There's access to good health care is lacking. There's also a little bit of education is lacking in that, when myths like this still exist, where people don't think that Black people get breast cancer, obviously we are lacking in some of the education that we need to disperse to everyone that we're all at risk and that they should go for the screenings. And then there's things like people can't afford mammograms, they can't afford health insurance to be able to go see a doctor if they have a lump. So those things, I know that at my hospital we're trying to address individually, but it's got to be a nationwide effort to try to address some of this to be able to get healthcare to people where they are. And I know it's a challenge, but I think it's doable.
Absolutely.
Can I add one more thing too?
Yeah, go ahead.
Just think about the statistic alone. Sorry, that's background noise. 77.3% of Black moms are single moms. All right, with no disease. All right, so look at that number alone. What is a mom going to do? Is she going to go get screened today, or is she going to go to work and feed her kids? Is she going to miss a chemo, or is she going to feed her kids? Is she going to, so her priority is on her kids. And so, we all take care of everybody except for ourselves. And so that statistic alone has a huge impact on how you deal with breast cancer and how you get screened, everything about every illness, really.
Everything,
because the mom is going to take care of her kids, right?
And
that's her priority.
Right.
It also hits on your point about stress, your point about stress, and Dr. Javita's point about it being hormonal. One of the reasons that could, put you at more risk of getting breast cancer is, a hormonal imbalance. And stress, we know, affects that. So it makes sense. It all ties in. All right, I'm going to, Kayla, I'm going to bring Kayla right up because I know Dr. Javita is next and busting the next myth. So I'm going to.
that was very, very informative. Very, very informative. That was. But Dr. Javita, this is for you. So is this a fact or a myth? So chemotherapy is the only treatment for breast cancer?
So this is a myth. It's definitely a myth. There are three main ways that we treat breast cancer: the surgery, radiation, and chemo. Those are the three main ways. Not everybody that has breast cancer is going to need chemo. And
Okay.
chemotherapy is probably one of the most visible forms that you're going through breast cancer treatment, because you're going to lose your hair and everybody's going to ask you questions. So it's very visible, and that's what a lot of people are afraid of when you talk about breast cancer treatment. But not everybody that has breast cancer is going to need chemo. Why do I say this? Because the reasons we need chemo has to do with how aggressive is the breast cancer, how advanced is the breast cancer. So if a woman comes to me and she has early stage breast cancer, stage 0, 1, 2, there is a likelihood she's not going to need chemo. So it goes to the importance of early detection. It goes to the importance of being aware of our breasts, being diligent with going in for your yearly screening mammograms and keeping up with doctor visits, because we may not be able to prevent breast cancer, but we want to be able to find it early, because early detection means possibility of not having to lose your breast and just have a lumpectomy, and possibility of not needing to get chemotherapy, which is for more aggressive breast cancers.
Yes.
So so it's a myth that chemo is the only treatment. There's surgery and radiation as well.
Okay. Yes. Well, thank you for that. I did have like a follow up of now proton therapy. Is that something that would be a what someone could also look into? That would be a little bit less invasive as well.
Uh, Proton therapy, as relates to radiation, maybe, is that what
Mhm.
you're talking about?
Yes, ma'am.
We don't use radiation alone, or uh, radiation proton therapy for breast cancer. We usually add radiation following surgery.
Okay.
So if a woman has a lumpectomy, we follow it up with radiation,
Mhm.
because statistically, it's equivalent to doing a mastectomy. So if we offer somebody a lumpectomy, we will follow it up with radiation.
Okay.
Um, and if the proton therapy that you're talking about is radiation, then again, it's not a standalone therapy. It's done in addition to. And sometimes we would do that even after a mastectomy, depending on how advanced the breast cancer is, if there are lymph nodes involved, if it had spread elsewhere, etc.
Okay. Okay. Yes, ma'am. Well, thank you so much for that. Thank you. Thank you. So back to you, Portia.
Yes, yes, yes. Okay, so Ricky's going to take our next question, but let's go right to it, or our next statement. All right. Fact or myth, Ricky, mammograms are only for older women. Okay, Ricky. Oh, Ricky, you're on mute. Unmute yourself. Yep.
Sorry.
No problem.
That is a myth. As I said earlier, Black women under 35 are getting breast cancer at twice the rate, dying at 3 times the rate, and it's well before the standard of getting a mammogram at 40. Um, mammography is the main way to diagnose breast cancer, but it's also self-awareness and self-exams that you need to do at a younger age. But again, as I said earlier too, if you have a family history, you want to get a risk assessment that will help you understand her story, your family history, and your genetic profile, so that you know at what age to get a mammogram. And a doctor can help guide you through that. If you don't have a family history, the standard age is age 40. And I don't consider a 40-year-old an older woman. So that would be a myth even under those circumstances. So, but know your bodies, know your body. I can't stress that enough. Look in the mirror, touch your boobs on a regular basis. So if you do feel something abnormal, you can go get it checked out, and don't wait. If you start to feel something that you didn't feel a month ago or you didn't feel a week ago, go get it checked out.
What about genetic testing at all? I mean, with that, like if you get some sort of, if you do that testing, then that I could I would assume that maybe you would probably get a mammogram earlier
Yes.
if something was,
And that's the
you know,
purpose
the
of the
result of
risk
that.
assessment. The risk assessment,
Yes.
a doctor will help you decide at what age is best for you. So, for example, if your mom got breast cancer at an early age, say she got breast cancer at 45, then you should probably get your first mammogram at 35, 10 years before that.
Mm.
And there's some guidelines around that. But again, if you do have a family history, it's really important to, have those conversations with your doctor, and get checked. But regardless, most women actually find their own lump before they even go get a mammogram. So that's why it's so important to touch your bodies. My little big boobs are bigger than the ones that try to kill me. But and probably if I had been doing self exams, I had a small a tumor the size of a peanut under my left nipple that I didn't feel myself until my doctor pointed it out. But I had
Wow.
gone to my doctor, guess what, for my annual gynae checkup. So do your checkups, know your bodies, and check yourself so you know. But you should get the standard age again is 40, but for Black women that's really too late if you have a family history.
And I also think it's important for people to know, what are you, and for someone who's a survivor and has been through this, what are you feeling for exactly, or how are you feeling? And I'm not trying to be all provocative
Yeah, no, but
but what are you like kind of feeling for, or
you're
what you
feeling for
are
something
learning?
abnormal, but there's other symptoms. Your breast could look a different way. They can have a rash, but there's a lot of apps online, and you can even reach out on our website that we can find how to do a breast self exam. And now actually doctors are calling it breast self awareness.
Mm-hmm.
So but there's a lot of apps that can do it, but you want to feel around, and you can't really see me, but around your boob,
Yeah.
and then under your armpits. Right, it's really important to feel all that. Like my breast cancer was actually in my lymph nodes when I got diagnosed, and so that's why I was, stage 3A. But I would, defer to one of the apps that you can find.
Yeah,
They're all over the
definitely.
place, and even ask your doctor. And if you've had an exam from your doctor, they can even show you how to do it. But there's plenty of ways to learn how to do it. We actually had one of we have an HBCU internship program. So we can talk about that too, because I'd love to hire some interns from your students. And one of them actually did a TikTok video on how to do a self exam. So we have that on our Facebook page. So there's lots of, but reach out to me. We can get you the tools that you need.
Thank you for that, Ricky. And Ricky, definitely, reach out for more information with Black Breast Cancer Alliance. For more information about how to be more self-aware of your body. Let's go to Kayla with the next Mythbuster question.
Yes. Thank you, Portia. So this is going to, piggyback off of what Miss Portia and Miss Ricky were speaking of. So Dr. Orrery, this is for you. So fact or myth, self examination does not detect growth or abnormalities in the breast. Is that fact or myth?
That's a myth. That's a myth for sure. Like Ricky said, being aware of your breast is really important, and being aware of your breast from puberty is super important.
Mm-hmm.
I want women to, from when they start to develop breast, just to feel around. You're feeling for lumps out of the ordinary. You're feeling for anything that looks out of the ordinary. And typically, I want you to wait about a week or so after your period before you start to check, because that's when the breasts are going to be the least lumpy. So again, you're feeling for lumps. You're looking at the skin of the breast. Are there any rashes that just is not going away? Is there any dimpling of your skin? Is there any discharge from your nipple? Those are all things that we need to be concerned about. And then, like Ricky said, yes, not only examining the breast mound, extending up to the collarbone and going up under the armpit is important, because you're feeling for lumps under the armpit that may indicate that there are lymph nodes that are swollen, which is typically the first place that breast cancer would travel to. 40 is the age that we start doing mammograms. So that means that before 40, you're not doing mammograms. And we know that there's a high rate of breast cancer in African American women under the age of 40. So how are we going to detect these breast cancers if we're not doing imaging? So breast exam or breast self-awareness becomes super important at that point. The other thing is that I just want to touch on the reason that we say mammograms are better over the age of 40. It's really because mammograms under the age of 40 a lot of times is not a good, we don't get good imaging to determine if there's a lump or not. The reason is because young breasts tend to be dense. Dense breasts mean that the breasts have a lot of glandular tissue because that's what the breasts are supposed to be. You're getting ready for breastfeeding, you're getting ready for pregnancy. So it's a lot of glands, a lot of hormonal activity. So things are really dense or thick, and think of it as a forest and trying to look for something in the forest. You're not going to be able to find a lump on a mammogram of someone who has dense breasts. As we get older, we lose a lot of the glandular tissue and it gets replaced by fatty tissue. So this is why the breasts start to kind of drop and the breasts are softer. And it just makes it so much easier to see breast lumps. Breast lumps almost jump out at you when you look at a mammogram in an older woman because the breast is all fatty, it's less glandular. So if we can't rely on mammograms in younger women, what can we do? We can do breast ultrasounds, we can do breast MRI. So there are other ways to look at younger women to evaluate their breasts. Like Ricky said, if you are high risk or you have a strong family history, again, importance of knowing your family history, you come to me or go to your doctor and we'll do a risk assessment. If we find that you're high risk, we will want to start imaging you younger than 40. And that imaging may include a mammogram, but more than likely it would include an ultrasound and a breast MRI. And a lot of times we do that every 6 months because we're trying to find things before they become big problems. So yes, mammograms are important. Self-breast exam is important. But when you are younger, we're probably going to add a breast ultrasound or breast MRI. And as far as the mammograms are concerned, make sure it's a 3D mammogram because 3D mammograms are the standard of care today. They are going to pick up things so much better than the old mammograms used to. And I think for the most part, a lot of mammogram places now have converted to 3D. Just ask though, and if they don't have 3D mammography, go find some place where they have 3D mammography because you don't want to miss anything.
Right, right. Now, also, Dr. Orrery, I know that Ms. Ricky was stating that she had found that she had the cancer within her lymph nodes. Now, is there any way that we would be able, because we were speaking of like high levels of estrogen, so is there any way that we would be able to detect like through blood work, like if our levels may seem to be a little bit higher than, normal when it comes to just our like womanly hormones?
Yeah. Unfortunately, hormone levels don't tell us whether you have breast cancer or not.
Okay.
And unfortunately, there's no particular blood test that's going to be able to detect breast cancer.
Okay.
The only way really is feeling for something or doing the imaging that's going to show something. And then, of course, getting a biopsy to see what it is.
Right, right. Yes, ma'am. So thank you for that. Thank you for that, Dr. Rory. We appreciate that. So back to you, Miss Portia.
Thank you, Kayla. All right. So our next myth, and I know this is a debatable myth, and very eager to hear Ricky's response. Actually, I know what her response is going to be, but it's definitely been debated. And there's definitely different sides of people who think, differently about how to treat and prevent breast cancer. So this fact or myth, Ricky, holistic remedies and eating healthy has no effect on breast cancer prevention and or treatment. Miss Ricky. I'm saying Miss Ricky now because I just Kayla, you're rubbing off on me with the misses. All right, go ahead, Rick.
Eating healthy. Let me just add something to the last question. So my lymph nodes were identified in surgery. You know what I mean? You really, so before you have breast cancer surgery, they actually you have a sentinel lymph node that they put dye into. And so when they open you up, they can see where the dye goes. And so they identified that they actually took out 10 of my lymph nodes, and I had cancer in 7 of them. So that actually happens, and that's how they stage you. So
you didn't feel anything then?
No, I didn't. My tumor was the size of a peanut under my nipple, but I didn't feel anything in my lymph nodes. No. I do have a friend who had triple negative, and it was only in her lymph nodes. She had breast cancer 10 years before, ER positive breast cancer, hormone-based breast cancer, and it came. She had 10 years later, she got triple negative, but it was only in her lymph nodes because she had no more breast tissue because she had a mastectomy, and so they were all in lymph nodes around her neck. She died in April, but she basically had, that's where the cancer appeared when it was diagnosed. But anyway. So, we actually have a naturopath on our medical advisory board, and we believe in healthy eating. Healthy eating is good for everything we do. Obesity is a cause of so many diseases. We believe in moving your body, but it really does not treat breast cancer, and it does not help with prevention. There's a lot of things about, can you prevent breast cancer? I don't really think you can. When I had breast cancer, I was riding my bike 30 miles a day, 5 days a week. I was really fit. I was in good shape. I was pretty healthy. I do eat ice cream every day, but I was overall pretty healthy. Breast cancer doesn't care. It just doesn't care. It doesn't discriminate. If it's going to get you, it's going to get you. But I've watched many women take a holistic approach to their treatment and die. And I don't want to say that it's a bad thing, but you have to make your own choice. But guess what? Healthy eating and holistic treatments in combination with chemo and radiation and surgery and all the other therapies that Dr. Jovita talked about work very well together. So yes, eat the broccoli, but also do the chemo. With triple negative, the holistic route does not work. I had an incident where we had a patient who got diagnosed at 26. She died 3 days before her 29th birthday. And she took a holistic route. She went to a holistic center in Mexico. Her dad was very against chemo and kind of talked her out of it. And it was a debate in her family. Her mom and her dad fought over how she should be treated. But age 26, who do you believe, your mom and your dad? And so she did a little bit of chemo. The chemo kind of made her sick, so her dad talked her out of it. And literally her cancer came through her skin, and she had a green thing coming out of her body. Her triple negative so all of the green juice she was drinking was going through the cancer, and it was coming out of her body, and it was a nasty sight. And when she died, her dad couldn't believe she died. He couldn't believe that his holistic smoothies and drinking the green juice and whatever, doing yoga didn't work. He was blown away by the fact that she died because he so believed in holistic. And I've seen that a lot of times. So go ahead, eat the broccoli, drink the green juice, do the whatever, and do the holistic, but get the chemo, please do the treatment, get the surgery, do what the doctor says. And a lot of doctors don't want to work with holistic stuff, but we have a great holistic medicine doctor, and she will work with you and help you. Her name is Dr. Aisha. She's phenomenal, and she will help you figure out a plan if you want to do that, take that route that coordinates and collaborates with your treatment. So call us. We'll hook you up with Dr. Aisha. She's awesome. Aisha Kachilko.
Interesting. How about, what do you, I know we're talking a lot about, well, they go hand in hand in terms of nutrition and eating well. Does that in your mind go for like even supplementation, herbs?
Yeah, and Dr. Aisha will help you with all of that. She, there's a lot of different herbs you can eat. There's a lot of just a healthy eating, a way to eating, just your nutrition. And there's been a lot of thought given into it. Does it cure cancer? We don't have any data to support that. No. Does it help you with your treatment, or does it help you feel better? There are things you can do differently that will help you deal with chemo. Chemo sucks. Okay, I can't say anything good about it. It sucks. You feel like crap. So are there things you can do while you're on chemo to make yourself feel better and alleviate some of the side effects that are holistic? Yes. That's what I would use it for.
Thank you for that. Thank you for that, Ricky. I appreciate that. Kayla, I'm going to send it back over to you for the next myth buster. Dr. Javita.
Thanks, Portia. Thank you. So that was very informative. But this is for Dr. Javita. And Dr. Javita, is this fact or myth? You will develop breast cancer if you have BRCA1 and BRCA2 gene mutations. Would that be fact or myth?
That's a myth. I'm going to address that in just a minute. But just going back to the last question about holistic treatments,
Mhm.
I completely agree with Ricky that it will help you feel better, and chemo sucks and all of that. The massages, the yoga, the juices will help you feel better. It'll help you get through the treatments much easier, but it doesn't replace the Western medicine or the treatments that we know about. And like I tell my patients, if these things work so well, we would be recommending it to you. But we're not recommending it to you because there's no data that it works.
Mhm.
So, anyway, everybody is entitled to do what they want to do, what they feel is going to help them. But there's science in our current treatment for breast cancer. There's science-based. We've got data that it works, and you really should go with something that works over something that you don't know about. Okay.
Yeah.
So back to the BRCA genes. So we have, over the past maybe 20 years or so, discovered these genes that we know increase the risk of breast cancer. These are genes that are passed on to you from either your mom or your dad. BRCA1 and 2 are the most famous because they were the first to be discovered. The risk for developing breast cancer from having BRCA1 or 2 is anywhere from 50 to 70+%. So it's not 100%. There are some genes that have a lower risk, about 10, 15%, and then some have 70+% chance of developing breast cancer. So what this means is that if we test you and we find out that you have one of these genes, there is a chance that you will develop breast cancer, but there's also a chance that you will not develop breast cancer. We just don't know if it's going to happen or not. We make some recommendations based on this. So if you've got 70% chance of developing breast cancer, one of the things we talk about is doing the preventative or the prophylactic mastectomies, or doing intensified screening, so that if something were to develop, we're able to find it sooner rather than later. But it's not a 100% chance that you will get breast cancer.
Yes. Thank you for that. Dr. Rorari. We appreciate that. Yes, ma'am. So I'm gonna send it back over to Miss Portia.
Actually, you know what? And I do want this one. We're wrapping up, but Ricky, I do want you to address this really quick. We had literally 5 minutes left. And I want to go to the question, the myth about all lumps found in breasts are cancerous. If we can go to that myth. Um, um, yeah, that one. There you go. I just want you to address that because I do hear about that a lot. Can you address that quickly? Fact or myth?
Thank God they are not. Not all lumps are cancerous. But if you have anything suspicious, because I can't stress enough how important it is for you to know your body, go get it checked out. Just don't make any assumptions, and you won't know until you have a biopsy and it's validated. But if you feel something different, go get it checked out. We're all busy, crazy women doing everything for everybody, working, taking care of our families, taking care of our parents. Go get it checked out, and I hope to God that it isn't cancerous. But don't take the risk and make a guess about it. Get it done. To the earlier question too about naturopathy, the data that we have on our drugs is still very limited by the number of Black women participants in the research. And guess what? I haven't heard of any data about naturopathy on Black women. None.
I think there needs to be data all the way around on
Yeah.
everything. I mean, but like you said, we need to get Black women to participate in research, and
Yeah.
there is a lot of mistrust in our healthcare system, so it makes it hard to get the data.
But do it for your daughter. If you're scared, if you're fearful, do it for your daughter. So you'll be here for your daughter, and so your daughter won't get breast cancer. I mean, I have 3 precious grandbabies, and they're all dressing up for Cinderella costumes right now to drive an old carriage. Belle is 4, and she's my purpose. The way I look at it, I've got 10 years before she gets breasts. So my goal is to get rid of breast cancer by then. She's my purpose.
That's it. Yep. I absolutely understand that and believe that. And thank you so much, Ricky. If we can bring everyone up to the forefront here, Dr. Javita and Kayla, as we wrap up, just our amazing presenters. Ricky Fairley, thank you so much for participating in this. Thank you so much for being our sponsor again. Ricky is the CEO of Touch, Black Breast Cancer Alliance. And thank you so much for participating in this event. Dr. Javita is a breast cancer surgeon. Thank you so much for your time. Kayla Scott is our college ambassador who helped us in moderating this workshop. So thank you so much, Kayla. So again, I appreciate you all, and I appreciate all your support. Have a great morning. This was very, very informative.
Be blessed. Check the breasts that you love. I know you have a pair.
Absolutely. All right.
Thank you so much for having us.
Absolutely.
Yes.
Thank you, Dr. Javita. Thank you, Kayla. Thank you so much. All right. So I hope you guys learned a lot. This was, oh my goodness. I mean, I see the comments here, of people who have actually been through this, and people just intrigued and want to know more, and found that this workshop was very informative. Across the screen, we have Ricky's information. If anybody, heard some things and they have more questions, please feel free to reach out to Ricky from Touch. Again, she's a breast cancer survivor, triple negative survivor, has a wonderful story, and she knows a lot about this, disease, and how to hopefully, prevent it. We talked a lot about that. It's just knowing your body, and kind of putting you first. I know that we have all been through a lot, especially as Black women, and we take on a lot, but sometimes we just got to make time for ourselves. So we can hopefully see things. If there is something, see it before it actually gets any worse. So moving right ahead, our next workshop is holistic breast cancer prevention with Dr. Lauren. So stay with us. Right after the break, we'll go with that.
What did it take for me to overcome breast cancer? It took the crucial first step of choosing MD Anderson Cancer Center. It took a unique multi-team approach and a comprehensive treatment plan so personalized that I trusted my doctors with my life. It took a deeper level of expertise to triumph over breast cancer and handle anything that comes my way.
What will we do in the pursuit of making cancer history, whatever it takes?
Introducing Rain Premium Sanitary Napkin. 50 milliliters of water will be poured onto a rain pad to test the absorbency system. Rain has an innovative design that is made with a strip infused with Nobel Prize-winning material, graphene. Finally, her feminine flow has met its match. Click the link below to order your rain pads today.
What does it take to be the nation's #1 cancer center? It takes subspecialists with an unmatched depth of expertise to turn research into breakthroughs and trials into groundbreaking treatments. It takes prioritizing safety, compassion, and an unwavering commitment
My last chemo.
to ending cancer. What will we do in the pursuit of making cancer history? Whatever it takes.
Greetings, everyone. I'm Dr. Lauren, and I'm here to talk about holistic breast cancer prevention. So I was listening to my former presenters that were speaking about the holistic care and so forth as it relates to the integrative medicine piece, in which I totally agree with. I agree that when you are presented with breast cancer and so forth, that the integrative approach is the best approach in terms of working with your team of oncologists and your team of holistic medicine doctors and so forth, and also actually determining a plan that definitely works for you. But what I'm going to share with you, what is actually happening with your body. And first, I'm going to share with you a little bit about what's happened with me. So for myself, I am at a place now where I have not experienced breast cancer personally, but I definitely have had those in my family who have. My paternal grandmother, as a matter of fact, was experienced breast cancer, and she ended up having a double mastectomy. For myself, as they may have shared, women generally under 30 were not getting mammograms and so forth. So when I came along, as I shared my health history with my doctor at the time, I began getting mammograms at the age of 35. And I thought it was a little abrupt. And she said, absolutely not. Thankfully, I had a doctor who was on top of a lot of, women's care, and she definitely believed in it. And so for me, the very things that the doctors mentioned on here was what I experienced. I had a lot of, at that age, a lot of, what would you call it? I called it a lot of fatty tissue, a lot of glandular tissue. And so I was getting at one point, they couldn't see what in the world was going on. And so I was getting 2 mammograms a year at a certain point. But after I became of a certain age, I'll put it that way, it kind of slowed down. And after I lost 101 pounds, I didn't have to concern myself with that anymore, because they could actually see what was happening with my breast. And as of this age, I still, fortunately for me, have not had to address this. And my heart goes out to those women who absolutely have. Make sure you're following the protocol and so forth that your doctors have for you, and make sure that you are definitely taking care of yourself. So my background is I am a certified health coach. and I work with individuals to care for their bodies as much as they can up front. As they also shared, is that breast cancer definitely does not discriminate, and I've seen that over and over again. Within the last 2 years, it's become progressively more aware or more prevalent with people that are around me, and they're getting diagnosed with more aggressive forms of breast cancer. Okay, next slide. So for myself, what I actually experienced was a lot of, I would call it lifestyle diseases. Whereas I did not deal with the breast cancer component of it. It was a lot of um, environmental illnesses that I would say. So I dealt with the obesity, and I dealt with the pre-hypertension. I dealt with not necessarily the diabetes, but I had the asthma and so forth. And a lot of the things that, and this is just my opinion, a lot of environmental things that are bringing on other stress-related illnesses that we're experiencing now in this environment. And in this month, when we are celebrating, or we're talking about breast cancer awareness, we want to be cautious of all of these things as well. So I always share my before and after picture, because a lot of what I'm seeing with a lot of us is lots and lots of inflammation. And so we definitely want to take care of our bodies, so that when we get to the place, if in fact, God forbid, we are diagnosed with a breast cancer, no matter which kind of it is, our bodies are equipped to handle those traditional medicines that I deem are necessary for women and men to absolutely have. Okay, next slide. So I'm going to look at nutrition. I'm going to talk about exercise. I'm going to talk about resources that women with holistic breast cancer, in terms of breast cancer prevention. And when I talk about that, what I'm sharing is making sure that your body is up to its optimal care in terms of just the daily life that they share when moms are experiencing the day-to-day, when they're taking care of their children, when they're taking care of the families and not taking care of themselves. Make sure that you are taking care of yourself as much as possible, so that you can eliminate as much as the stressors that you have on your bodies. Cancer is a stressor. Day-to-day life is a stressor. The work-life balance is a stressor. I think they shared something about 70% of women are like single moms. That's a stressor, most definitely. So you definitely want to make sure that you are taking care of your body, watching the foods that you are putting in your mouth, because let me tell you, these companies are not paying attention. They're not concerning themselves with what they're putting in the food. So you have to be mindful of that. In addition to the other things that you're dealing with in life, you have to be mindful of all of those things and the sources from which they're coming from. Next slide. Now, these are the statistics that I experienced, that I came up with in terms of doing my research. So the woman's lifetime risk of breast cancer is 1 in 8. Breast cancer has the highest mortality rate of any cancer of women between the ages of 20 and 59. I'm sure they share that with you. African American women have a 31% breast cancer mortality rate, the highest of any U.S. Racial or ethnic group. That is frightening. Among women younger than 45, breast cancer incidence is higher among African American women than than white women. Very, very high. And my question is always, why are we experiencing this? Next slide. Why is it that African American women are experiencing this? So I wanted to share some of the critical pathways that we are dealing with. Go forward. Dysfunction in one or more of the following pathways can increase your risk of cancer. Your immune system, controlling inflammation. That's the obesity, those lifestyle diseases, hormonal imbalance, They talked about that in the previous session where they're talking about estrogens, a high incidence of estrogen. Some of you all might have heard of it as estrogen dominance. We experience that all the time. Estrogen dominance is experienced with a lot of younger people or adolescents. When you're looking at estrogen dominance with the cramping that young girls experience on the monthly basis, why are they getting the cramping when they're having their menses? That is estrogen dominance and so forth. Way too much imbalance in your hormones. You have your insulin sensitivity and you have digestion and detoxification. All of these things, because you have a lot going on in your system. You have a lot going on in the environment that are contributing to these as well. And so when you're younger, we've all been there. You're not really paying attention to all of these things. And no one is explaining this to you as to what's going on in your body. Thankfully, I had an obstetrician or a gynecologist that said to me when I was a young woman, she said, you have way too much estrogen in your system. She said, you have to look at a holistic approach in that. And she told me, actually, she was this particular doctor, I'm no longer with her and she's no longer with me, would share with me some of the things that I needed to remove from my diet. And she said, you'll stop having these issues with your reproductive system. It was very interesting. Okay, next slide. And I was very thankful to her for that, for sharing that with me. But your immune system works hard every day to regulate the invaders that you are getting in and out of your body. When your body is constantly under attack, it goes into overdrive. It's creating stressors in your body, and you really don't pay attention to that. And when people are saying, I eat really well, and I'm eating, the interesting part about it is you don't know what eating well is for your body. You do not know what eating well is for your body. What's happening is a chronically activated immune system can increase a cancer risk. So when you're chronically activated, when you're chronically stressed out, guess what? Your body is going, I can't take anymore. I cannot take anymore. And then it begins to what? You begin to get fatigue. Your body begins to be exhausted. And then you end up having to you're running to the traditional medicine and you're going, listen, I need help. And guess what? At that point, they begin to do what they are trained to do. And they are helping you with what you're dealing with, whatever that situation is at that point. Okay. Whether it be heart disease. But this month, we're talking about what? We're talking about breast cancer awareness. Next slide. The next thing I want to share with you is controlling inflammation. Inflammation is oxidative stress. Again, it's all environmental things that we're looking at. Oxidative damage is generally induced by environmental toxins. We deal with that from the time we wake up in the morning until the time we go to bed at night. These things cannot be controlled, okay? So what is it that we're working with? Processed foods, okay? I always share with people, when you are driving through the drive-through and you're talking through the clown's mouth, all of those are processed foods. I don't care where it is that you go. Artificial ingredients, those are stressors on your body. Lack of exercise and stress, those are stressors on your body. You can run, I think I heard Miss Ricky say she was running like 30 miles a day or something like that. People think that they can eat the way that they want to and still exercise and it's okay. You're fighting it. You're fighting back and forth, back and forth. It's an exchange of that. And you're creating stressors on your body. A decrease in antioxidants in your body causes an increase in chronic inflammation. Trust me, I went through it. My body shot up to 101 pounds. I lost a whole body. I lost a whole person. Chronic inflammation causes excessive cell growth and inhibits apoptosis, cell death, both which can increase your risk of cancer. Okay. And I'm sure you may have heard this before. Definitely in controlling the inflammation and making sure that you do as much as you can on your end to help keep your body well. Okay. As I said before, definitely whatever's going to happen to your body is going to happen to your body. However, you want to be in as much good health as you can to do what? to be able to fight off these things that come along, because life definitely will happen. Next slide. Hormonal imbalance. This is something that many of us have dealt with. I know, let me speak personally. I have dealt with this for most of my life. It's caused when potentially 50 different hormones are not working in harmony. Okay. If one hormone gets out of sync, the other ones get out of sync as well. And so you definitely have to make sure that you are doing what you can. Now, life happens. And depending on what your environment is, your level of stress may be high or it may be low. Example, cortisol can suppress your immune system and increase blood vessels to tumors when it's produced in excess. Breast cancer cells are covered with estrogen receptors and several insulin receptors, which can drive the growth of cancer. Okay, definitely try to look at balancing your hormones so that you can have that even flow there, and you are what? Warding off all the things that could possibly happen to your body. Next slide. Insulin sensitivity. When your cells lose their sensitivity to insulin, they can no longer effectively uptake glucose for energy, and they even lose many of their insulin receptors. A normal cell has 200,000 insulin receptors, while an insulin resistant cell may have only 2,000. Okay, so that is what it looks like. That is definitely what it looks like. Next slide. Digestion and detoxification. This is definitely what I work with people on in terms of making sure that your body is at its optimum working condition. I definitely believe in this because this is where I live in terms of digestion and detoxification, because this is what helped me along my wellness journey. So for me, I was diagnosed with an autoimmune disease. And so for my autoimmune disease, I took the natural route. I definitely did not have to take medication or anything like that, because for my diagnosis, it wasn't necessary for me. Okay, I did not have to go the traditional medicine with taking a prescription medication, because I was able to do it with just food and with supplements and so forth at a certain extent. However, for breast cancer, that is not the same. Okay, so I definitely will tell you that, and I'll reiterate again for those individuals who are diagnosed with breast cancer and so forth, to follow your doctor's protocol, because they do know your case best. Roughly 80% of your immune system is in your gut. If your gut is dysfunctional, your immune system is dysfunctional as well. Your liver and your GI tract work in consort, and the liver requires detoxification. Make sure that you are detoxing your system twice a year. I always tell people that always try to detox your system at least twice a year. Whatever goes in, it must come out. Everything works in consort together. Your liver, your kidney, your gut, they all work together in order to make sure that your body is working in its optimal condition. The dysfunction of either one of those cause inflammation, and it brings about decreased immunity, and it increases inflammation, which leads to a high cancer risk. Okay. Now, for those individuals who are experiencing these things, when you have the sluggish body, when you have the brain, what do I want to call it? The brain fog and so forth, it's definitely something that's going on with your system that you want to check out, and you want to make sure that you're looking at everything to see what is happening here. Next slide. Now we're going to talk about the food a little bit. Now I did hear my speakers, speaking earlier about that, and they started talking a little bit about the food. Next slide. So some of these things that you want to look at, a lifestyle which is high in fruits and vegetables, they can offer some protection against breast cancer. When you are going through your breast cancer treatment, whether it be, why am I losing my thought processes? Whether you're looking at the radiation, whether you're looking at the chemo, whether you're looking at the mastectomy, whatever treatment they have for you, you definitely want to have support systems in place. There are some resources that individuals can work with in terms of integrative medicine to look at supporting your breast cancer treatment. 5 to 10% of individuals with breast cancer are genetically passed, whereas the rest is a result of the environment. Optimal nutrition and lifestyle can reduce the risk of developing cancer by 90%. Now, this is according to the research. This is not according to Dr. Lauren. This is according to the research. Next slide. Now, some of the foods that are suggested in terms of breast cancer prevention and supports are the anti-inflammatories, which are onions, broccoli, eggplant, celery, lettuce, peppers, tomatoes, potatoes, oranges, melons, and apples. As I said, there are some systems or some resources that often come through breast cancer, how can I say it, centers or breast cancer support groups and so forth, where they will bring you those packages each month as to what it is that you need to help in consort with your breast cancer treatments. These are the things that you do not want to eat. Please stay away from the processed foods. Processed foods are not your friends at all. They can actually help to slow down your progress in terms of getting through, bring it forward, Ryan, in terms of getting through your treatment and so forth. And you definitely want to stay away from the alcohol. Do not touch the alcohol. Do not touch the wine. All of those things are not very good for you. It is good for you in terms of black tea, coffee, chamomile tea to support your system, okay, in terms of a healthy constitution. But again, you definitely want to leave alone a lot of those sugars. They definitely do not work for your system. And stay away from the wine and the alcohol. They metabolize in your system as pure sugar, okay? Next slide. Eliminate the alcohol. It is closely linked to breast cancer. The more you drink, the greater the risk. According to the British Medical Journal, light to moderate drinking increased breast cancer in women by 13%. Now, I want to say this. Whenever I coach women in terms of doing their detox, the one thing that they talk about is I can't leave my wine alone. I cannot leave my wine alone. When you are going through the process, you have to leave the wine alone. You definitely have to leave the wine alone. It metabolizes as pure sugar in your system. It is not your friend. You know the little gut that we get there, or the little pooch, or the little pouch there at the bottom? There's definitely contributing to that. You want to leave the alcohol alone, and you want to leave the sugar alone. All of those things that you are wanting to hold on to, you have to let it go. You definitely have to let those things go. All right. Next slide. Okay. In terms of fitness, here's some things that you want to work on because many of us, and I'll speak for myself, live before my 101-pound loss. I wouldn't say a fairly sedentary lifestyle, but it was not as active as I wanted it to be. So yoga is one of my favorites. It is improvement of quality of life, reduction in anxiety and stress. It definitely helps with the anxiety, reduction in depression, decrease in fatigue, improvement in mobility and function, manages and reduces pain, believe it or not. And people do not realize how active yoga or how much cardio yoga is. And it's definitely helpful in your increasing your health. Next slide. A brisk walk. Walks are very, very healthy, believe it or not. If you just get out maybe at lunchtime, some people say they don't have a lot of time to do anything. If you're one of those people that stay on your phone the entire time, that you're even at lunch, walk while you're talking on that cell phone. Whoever you're talking to, just walk while you're talking on that cell phone. Even though it's not a good thing to do, you want to detach from the electronics, do your walking, and it'll definitely help you in terms of your health. 30 minutes a day. definitely cuts the breast cancer in half, according to the research. Additional data shows 45 minutes a day of moderate exercise can prevent about 5,500 cases of breast cancer. So once you get out there and walk, I think we had a challenge in Black Girl Health this month in terms of walking. So hopefully you got out and did that. Next slide. Aerobic exercise helps to lower cholesterol and your blood pressure, increases endurance, lowering resting heart rate, weight loss, and or maintenance. It's definitely a stress reliever, improves your sleep, increases exercise, and decreasing body fat can reduce the risk of breast cancer for postmenopausal women. And I think I may have heard them say this is when a lot of the breast cancer is found in women because of the reduction in the glands. Okay, the glandular fat or the glandular, function in the breast. Aerobics exercise can include walking, swimming, running, biking, dancing, and hiking. It definitely helps to improve the heart and lung function. And we want everything to work in healthy consort, right? Next slide. Does this include processed foods that are vegan and vegetarian? Processed foods are processed foods. It doesn't matter whether it is, I think you're asking me, is it vegan or vegetarian? It doesn't matter. Processed foods are processed foods, no matter what it is, because there are some quote unquote healthy foods that are processed as well. Okay, they're just marketed that way. They're marketed that way. It's by design, just so you know. And I talk about learning how to read labels and so forth when you go into grocery stores and learning what are those things that are on the label that are definitely not healthy for us, but they're marketed that way in the stores. And it's by design. They don't want you to know what is actually healthy and what is not. All right. Eliminating body fat. Eliminating body fat. Reduce calorie intake. If you are more sedentary or burn more calories, okay, by exercising, you want to eliminate that body fat that you had there. Your body fat actually serves you no purpose. I'm going to tell you that right now. Body fat serves you no purpose. Some people are like, okay, yeah, this fat that I have on me, I'm taking it with me, with me to my grave. You certainly are, sooner than you think, if you don't get rid of that stuff. Physical activity may protect against breast cancer by reducing body fat. All right. It's a risk for breast cancer. Get that body fat off of there. Some people are like, I don't know what to do. I don't know, what to eat and so forth. Let me tell you, I'm a perfect example of running from food because I have a lot of allergies. I have a lot of allergies. And for me, I have to determine what is it that I can eat this week? What is it I can eat this month? What is it that I can eat next month? I can eat something this week that next week I'll have an allergic reaction to. It's really crazy. So I have to really keep up with my allergies and figure out what's happening, with my body. It's a journey. It's not a destination. According to JAMA, a year-long program of aerobic activity decreased body fat in postmenopausal women. It showed 300 minutes of moderate to vigorous exercise was more effective at cutting body fat than 150 minutes per week. Okay? So just so you know that, you want to eliminate that body fat. You definitely want to eliminate that body fat. I had a lady that said to me this past week, and she said, you do a really good job of keeping your weight off. I said, it's a conscious effort to keep my weight off because I know what happens to my body when I don't. When I gain inflammation on my body, my autoimmune disease does not like inflammation on my body. So I have to keep it off. I definitely have to keep it off for me. But everyone has to know what works for them. All right. Next slide. Quit smoking. If you are a smoker, you definitely have to work hard at leaving the smoking alone. All right. And I'm talking about cigarettes. Leave those cigarettes alone. Tobacco has been linked to breast cancer. I think we've heard about this for years. Okay. It's been linked to this for years. For women who smoke one pack of cigarette, cigarette a day for more than 2 years, the risk was 35% greater than women who've never smoked. So it's just very interesting to see that people will continue to do so, even when they know what the risks are. Again, that's one of those things that people say, whatever I have, I'm taking it with me to my grave. Yes, you are. Okay. Next slide. All right. This was my journey here in terms of working on your body, in terms of making sure that your body is in optimum condition. This is what I did. And actually, the root cause of my inflammation was not what you would think in terms of processed food and so forth. It was actually mold. It was actually mold that triggered my weight gain up to 219 pounds. And with food and putting it in optimal condition and working with my doctor to learn what my levels were at any given time to get the weight off, I managed to lose 101 pounds, and it took me all the way down to 118 pounds. And that was with the detoxification and digestion management that I spoke with you about. So my question always is to people, what do you want your journey to look like in terms of bringing your body to optimal health? Next slide. All right. Now, if you'd like to get in touch with me in terms of learning how to maintain your body or getting your body into optimal health and so forth, this is how you get in contact with me. And I'll be glad to work with you in terms of my B-Fly Detox program that I have on a monthly basis. It is actually, next slide, it is actually a self-paced program that I work with individuals, next slide, work with individuals on their health. Okay. And you can go to my, thank you, Ryan. You can go to my website, www.laurencurewellness.com, and my B-Fly Detox course is there. It is a self-paced program. It is 6 modules, and it goes about teaching you how to develop your new lifestyle, how to launch your new lifestyle. Okay. And I work with you on that to help make you or place you into better health.
I'm sorry, I was on mute. Thank you so much for that information. And you know what I really like that you mentioned was detoxing your body. And I think we don't do enough of that. We get toxins in our body every day, like you said, from the environment, from the foods that we're eating.
Yes.
We really need to be detoxing our liver. All that is connected, just as you mentioned, our liver, our kidneys.
It's all connected. It is all connected. And when you are going through such a massive undertaking, such a massive wellness journey, as you know, I'll say our breast cancer survivors, because I'm gonna go ahead and claim it. Our breast cancer survivors, as many of them are they're in a fight for their lives.
Yeah,
it's as simple as that.
Yeah,
they're in a fight for their lives. I know, as I said, I've only had one person in my family that has gone through it, but I've had many girlfriends, and I just got a call last week of one who was diagnosed, and she had her surgery this past week. You know, God bless her. And she's gonna go through it like a champ, like my other girlfriend did, who was, oh gosh, she was almost at a stage. I think she was an aggressive stage 3. And she went through, she got the support with the integrative medicine. She went through it 2 years ago with the integrative medicine. She received her support packages every week on a weekly basis, her fruit and vegetables and so forth. And she had her integrative medicine plan as she went through it. As she got chemo and she received radiation, and she went through it like a champ. And she came through it. She worked full time.
Wow.
And went through her chemo and radiation treatments, never stopped working the whole entire time. And you know, I think as the lady shared earlier, you know, Black women, they just have to do. Absolutely. They just have to do. And when I tell you, she was under a massive, a lot of stress when she did that. And I finally looked at her one day. I said, you got to get off this roller coaster. You got to stop.
Yeah.
This foolishness has got to stop, because these people at this workplace do not care about you, and you got to get off this roller coaster. And she did. She did not realize what she had gone through after that.
Dr. Lauren, thank you so much for that, and encouraging people to walk, not always a lot of the intense exercise, can add stress to your body as well. And I love the fact that you were encouraging people to walk.
Absolutely. You got to get out and walk.
Yes, yes. Well, again, thank you as always. Dr. Lauren is also a BGH member. A lot of our BGH members actually host our workshops. And we thank you so much for being a part of our family, Dr. Lauren.
Thank you. Thank you all.
All right. So let's get to, let me do some different things I want to tell you guys about Black Girl Health, especially for those who are just joining us, have never heard about us before. Black Girl Health is an organization geared to improving the health of women of color. As I mentioned, a lot of these people that you're seeing host these workshops are our BGH members. If you're interested in becoming a BGH member, our BGH members are a lot of our professionals that who have businesses. They're health coaches, they're fitness coaches. They're therapists, they're all kinds of, they're survivors. These are people who want to help improve the lives of other women who are a part of our family. And if you're interested in becoming a BGH member, you can do so at membership.blackgirlhealth.com. It's going to be in the comments, membership.blackgirlhealth.com on Facebook. You can register and become a member. And we have our staff on standby who are posting that link in Facebook in the comments. In addition, if you're liking what you're hearing, we want you to fill out our survey. Our survey is also in the comments. We keep on posting the survey in the comments because we want you to comment, give your feedback on this workshop series. This is the first time we actually included the workshop series in our I'm a Survivor campaign. So this is our second annual I'm a Survivor campaign, but this is the first time that we included this workshop series. So we definitely want to hear from you. Also, a part of that link when you fill out the survey. We also want you to note that if you want to receive a notification about when we launch our app. So I should definitely mention that we have a membership app. There it goes, that we are launching pretty soon. So our entire Black Girl Health membership will be revamped into this app. So it will be a total app. And so that will be coming out in a couple of weeks. And this app consists of so many different features, especially for our professional members, which includes booking. You can book professionals right on the app. Our professionals will be able to do live events at any time about whatever they want to do events on, or talks, podcasts, right on the app. And you'll be able to participate in those live events and those podcasts right on the app. There's so many different features. You'll also be able to start your own clubs. Maybe you want to start a walking club. I know Dr. Lauren talked about, walking. You can start your own clubs on the app. So there's a whole lot of features. You'll also be able to be matched with other like-minded BGH members who live in your area, who like the same things that you like, as well, to help you go through this journey of living a healthier lifestyle together. So there's a lot of cool features that are coming with this new Black Girl Health app. So we're very, very excited about it. And if you want to be notified so you can download the app, if you want to be notified, then fill out that survey. On the survey, it'll say, if you want to be notified, give us your email. So make sure you put that down. So we want you, start right now. And I see the link it's in the comments right now. Fill out that survey. It's very, 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 very quick. All right. So next up is our I'm a Survivor workshop with Tanya Freeman. You're going to be hearing her story of surviving breast cancer right after the break. So stay with us.
What did it take for me to overcome breast cancer? It took the crucial first step of choosing MD Anderson Cancer Center. It took a unique multi-team approach and a comprehensive treatment plan so personalized that I trusted my doctors with my life. It took a deeper level of expertise to triumph over breast cancer and handle anything that comes my way.
What will we do in the pursuit of making cancer history? Whatever it takes.
Greetings and hello and welcome to I Survived Breast Cancer. I am your host for this workshop. I am Tanya Freeman. I am a breast cancer survivor. I like to go a little bit farther and say that I am a thriver. It's been 11 years for me. And as this picture above my head says, good things lie ahead or lay ahead. Yes, so it lays ahead for me, and it also lies ahead for breast cancer survivors. I'm going to talk to you today about prevention and clear intention. It's very important that if you are ever diagnosed with breast cancer, that you stop for a moment and you don't judge yourself, but you get very clear about how you want to proceed moving forward in terms of treatment, in terms of your medical team, in terms of your whole entire healing team and everyone surrounding you or who is around you at this particular time. It is very critical that you do this for yourself. But before we go into that, I am going to move forward to the next slide, Ryan. Just to give you a brief look at my story. Thank you. It's a video, and without further ado, we're going to move forward into the video so you can see. It's buffering. I think it may have stopped. The video stopped. So we're going to keep going. Hopefully we can get the video back online. There we are.
Circle of promise. 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 Circle of promise.
My circle of promise began when I was diagnosed on February 17, 2009 with breast cancer. I felt devastated, confused, isolated, and angry. I asked myself, why me? I thought to myself, what are you going to do to eliminate this cancer from your body? My mortality stared me in the face like a double-barreled shotgun. Well, my medical team, they gave me an opportunity to have a voice. And with that voice, I promised to close that circle by sharing my story, sharing my ups, sharing my downs along the journey, and also sharing with other women that they too can live. And that's what it's really about, living a life that you could be proud of. And that is being in the circle of promise.
Circle of promise. Circle of promise. Circle of promise. Circle of promise. Circle of promise. Circle of life. Circle, yeah.
Circle of Promise, I promise to share my truths and information with other people to inspire and empower them to be the best that they can be in their divine self, in their divinity, as they operate in this earth, in their humanity, to be their authentic selves, to realize that they are the power within them to affect change in their lives. With clear intention and focus, massage therapy is a vehicle to support, share, and serve the local, national, and global community in the expansion of health and wellness. I became a massage therapist so that I can give back to other women who receive a diagnosis like mine after me and know that it's not a death sentence, but it's a way to redefine and recreate your life the way that you intend it to be. As a massage therapist, I have the opportunity to advocate for breast and women's health issues. In order for me to be an advocate for others, I had to advocate for myself.
Circle of promise, circle of life, circle of promise, 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 circle of life, circle of promise, circle of promises, circle of promise, circle of promise, circle of life, circle of promise, circle of promise.
What a circle of promise means to me is that I promise to take care of myself. And even when I'm not taking care of myself, recognize that I'm not honoring my first promise, and that is to love and care for myself at every aspect of my life, in every turn, in every situation. I'm going to love myself and take care of myself and approve of myself, even when the outward circumstances may dictate otherwise. And overall, that's being true to yourself. So then that's in getting to know yourself in every aspect of your life.
Circle of promise, 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 circle of promise.
In the circle of promise, the statistics say that 1 out of 8 women are diagnosed with breast cancer. So breast cancer was my opportunity to demonstrate the power that I had within me to conquer and overcome the diagnosis I received. Cancer has no authority over me. I chose to have authority over it by education, by knowledge, and also first and foremost taking care of myself. And in doing so, I bridged the gap in the circle of promise.
Circle, yeah. Circle, yeah. Circle of promise, circle of life, circle of promise.
Wow. Oh my gosh, we're back. And I'm getting a little misty under my eyes. So let me clear that up. I don't really look at these videos much, but when I do, it reminds me of how blessed I am to be here. And I have to put these glasses on because I can't see. How blessed I am to be here to share with you, because it's transformative, this experience. And I just want to share with you who I am, and to, just to let you know, I'm Tanya Marcia Freeman Brown, and my pronouns are she and her. I am a native of the Big Easy, New Orleans, Louisiana, 54 years of life. I've been on this planet, on this journey. I am a widow. My husband was diagnosed with brain cancer in 2000, the year 2000, and he passed away in 2001. I have no children. However, I've mentored and taught many. I'm a metaphysician and a spiritual gangster. And guess what? I basically embrace all forms of religion and all forms of spirituality, as long as we're all on the path and it's pointing us directly to the Most High, and also ourselves as well in relationship to that. I am also a community health worker and a healing artist. As you saw in the video, it focused more on breast cancer, on massage therapy. And that's how I found massage therapy through my journey through breast cancer. Right now, I'm a community health worker. Let me slow down. The pandemic, COVID, changed and shifted me again to allow me to reinvent myself. Now, I still am in the wellness industry, in the wellness business, and I am transforming, or have taken all the things that I've learned in massage therapy, and I'm transforming that and incorporating it into a broader sense as a community health worker, as an educator, as an advocate, as an outreach person, boots on the ground in disaster response and recovery efforts. So with that said, we deal with hurricanes, we deal with COVID, the vaccine, we have conversations with people in the community, and it's a workforce development organization that I'm now a part of. So I'm able to bring all of those assets to this particular position to expand on what I am doing right here and right now. So this is community health, and I want to thank Portia, Ryan, the board members at the Black Girl Health Foundation for this opportunity. And I failed to do that in the beginning. So I want to make sure that I say that right here and now. And I live to create and master my life, my love, and my liberation. So that is who I am. My breast cancer journey and timeline: I was diagnosed January 25th of 2009. I discovered a lump in my right breast at the 12 o'clock position while I was taking a shower. Yes, February 2nd, immediately I had a physician's exam, an examination with my OB-GYN. She gave me a prescription for a diagnostic mammogram. I had that on February 9th. February 12th was my biopsy date. And on the 17th of February, never forget it, I received a phone call for breast cancer diagnosis. It didn't sit well with me, and I knew at the time I was under a lot of stress. And also, as a lot of the panelists have spoken of in the first two workshops, stress, Black women, stress, that's just been a part of us for generations. So I know, and I can relate to stress. I can relate to working a job and not loving it and not knowing where to go or what to do. And it became a vicious cycle of traveling and chasing money and chasing wealth in the way that did not resonate or align with my purpose. I was in dis-ease. I was probably inflamed. I was angry. I was angry for so many different reasons. And it all started many, many years before the cancer showed up. So I'm saying all that to say, this didn't sit well with me when I received the diagnosis. I felt that I was being pushed along through the process to have surgery and schedule appointments, schedule surgeries. And I'm saying to myself and to the doctor who offered or gave me the first diagnosis or the first opinion, I said, wait, I can't do this. So I had a first opinion. My first opinion recommended a mastectomy. That was in late February. I said, no, we're not going to do that. And I canceled surgery twice because something within me knew I had to go through the process. I had to sit and get quiet, then say, I'll seek a second opinion. And that was in early March. So we're looking at February 17th was a diagnosis. The mastectomy was in late February, or the opinion of the mastectomy was in late February. They wanted to move me along really quickly, and I said no. The second opinion's mastectomy. So one morning I am asleep and I get a phone call saying, Dr. Schnapper wants to see you at Greater Baltimore Medical Center. Thank you, Kayla. She wants to see you, and we can't guarantee anything, but you could just at least listen to her. This was it. I waited an entire month. And it goes to show you that you don't have to rush through this. This is a journey, and you have the right, you have the authority to ask for what you want, and also hold the physicians and those healthcare professionals accountable. First, you have to be accountable to yourself and advocate for yourself, or have someone else advocate for you on your behalf, because you should be at the table discussing what the process and the protocol will be. The third opinion, they recommended neoadjuvant therapy, which is chemotherapy. And it was a process. We're gonna do chemo first. Usually it's surgery, then chemo, then radiation. They flipped it on us. They treated me as a stage 3 patient. I received carboplatin. I also received Herceptin because I was triple positive. That cancer in my breast was driven by estrogen. I had an abundance of estrogen, and I do remember the year before I was diagnosed with breast cancer, I had fibroid surgery. I had fibroids removed. High estrogen, high influenced by estrogen. So I was fortunate to be able to take chemotherapy, carboplatin, and I forget the other one, and lost my hair, and was able to experience that. I had surgery in August of 2009. By that time, going through those rounds, 9 weeks of chemo, and it wasn't 9 consecutive weeks, it was a period of a treatment, and I would have to wait, and then I would go to treatment again, and about a month later. So before I was feeling better, I had to go right back in for the treatment for chemo. And going to chemotherapy, looking good and looking fly and really staying positive, I recognized that the lump in my breast began to shrink. And I can only tell you, it's nothing but God in the chemo, right? God can be in the chemo. God was in my chemotherapy. My ancestors and all those, my husband who had transitioned, I believe they were all surrounding me throughout this process. Because it shrunk, I was eligible for a lumpectomy. So I went in and had the lumpectomy. I had 6 weeks of radiation. I had 12 months of Herceptin. And I remember going back for my follow-up after the surgery. And Dr. Schnapper, my mother, Dr. Schnapper, was 3 women in the room. And by the way, my surgery, all women worked on me. So I felt so great about it. I have to tell you, when we sat at the table for the consult, post-surgery consult, she looked at the paperwork. Of course, they had to determine whether or not there was cancer in the lymph nodes. They took out the sentinel node and a few under my arm, my right arm. And she looked at the pathology findings, and she said, "I can't believe this. It's like you're at stage 0. And we all cried. We all cried. Now, not everyone has that outcome, but because I pushed for it, and because, I believed so strongly that I could overcome this, and that my life would be a testimony and a demonstration for the next woman, for the next girl. So I was so grateful for that demonstration, and I owe it all to God. Next slide, please, before I begin to cry. No evidence of disease in April of 10. And I'm still celebrating that to this day. Let's get into breast practices. I like that. It's actually best practices. I say breast practices. And you see me picture on the right. That was a campaign. Who's coming with me? Christine Brown took the picture. She's from New Orleans. She's a photographer, and she selected me to photograph with other breast cancer survivors. And the person who is behind me, who's kind of holding me up, is my identical twin sister, Sonia. That's her hands. And you see my little cuffs with the breast cancer ribbon, or the pink ribbon. And I'm fighting it out. I'm duking it out. You can also see the scar on my left side, on the left, below my clavicle, below my collarbone. And that was where I had the port where I received my chemotherapy and also Herceptin. So I want to start off with this quote: to begin with the end in mind means to start with a clear understanding of your destination. It means to know where you're going so that you better understand where you are now, so that the steps you have are always in the right direction. The steps you take are in the right direction. Stephen R. Covey, we have to begin with the end in mind. Visualize, feel, and embrace what you like to see in the situation. Next slide. You're going to move forward with breast practices. Okay. You also want to seek a second opinion, a second and a third, if you can, if you are diagnosed with breast cancer. Please do that for yourself. Don't always go with the first, because there may be other options available to you. Create a healing team. And that's what I did. I had people praying for me. I had prayer teams. I had people crying. I had people making food, cooking food, sending alternative practices. Oh, really? Yeah. Life has been a blessing for me. Thank you, Miss Imani. Thank you. What you want to do is create that healing team. You want to create your prayer warriors. You want to get that medical team. You want to get them in shape. You're going to say what you want nicely. And if you have to get it by force, you have to let them know. If you got to wild out, you need to wild out. That way, people will take you seriously. And that's what I did. I didn't want wild out, but I told them my story with my husband and how I went through that with him. And then 8 years later, I'm going through something similar. Cancer. They knew my story. They knew the first and second opinions. So they made sure to treat me well. If they're not treating you well, guess what? This is a business, and my body is my business. Your body, ladies, is your business. You can always fire them and go get someone else. There's so many doctors and so many protocols out here for you. You have a choice, and you can operate and use your power. You're going to explore other methods of care. Dr. Lauren Keir, detoxification is so important. And she spoke about wine, and I love wine. And I know it's filled with sugar. That's just my vice. And I'm going to own it. However, detoxification, liver detoxification, kidneys, all those things are to your benefit. Alternative wellness, I won't say alternative. It's other holistic options that are available to you. Massage therapy to get you to relax. If your body is stressed out and you have cortisol and those stress, fight or flight hormones circulating through your body, and if it's on autopilot, that means your body is out of balance. So there will be some dis-ease as a result of that. You just don't know how it will manifest. Mine manifested as breast cancer. So massage therapy, acupuncture, yoga, those things. Try to do those things or commit to doing something that you've never done before so that you can get your body back in balance. Diet. Dr. Lauren already spoke about diet, so I won't hit that. Fruits, vegetables, greens, lots of water, exercise. Before this event, I went out and I walked 2 miles. Took me 35 minutes to walk 2 miles. I had to get it done. mental and emotional detoxification. If you're holding things in your mind from years ago, if you're holding hurts, if you're holding unforgiveness, if you're holding envy and jealousy, the things you can't see, all those ego-driven, humanistic things and pathologies, let it go. We all get to let those things go, because if you hold them in your mind and you're constantly meditating on those things, it has a charge, it has power, and eventually you're going to start feeling it in your body. So if you need to forgive yourself first. And if you don't have to forgive, you don't have to forget either, but let's forgive and let's move on, and let's clear our emotions, clear our mental bodies, our emotional bodies, so that we can move forward into the life that we deserve to live. Next slide. Here I am in the picture. That was around the time I was going through chemotherapy. And that's a glass of, I don't know, that's not wine, but it's juice, it's something else. And I'm enjoying nature at the time, and I am taking a break. And someone caught that picture, and wow, I wanted to just give you a look of how I looked at that time. And I just want to say to you, self-care is the best care. This is a quote from my book, I Am Free, a gateway of 111 affirmations, healing mind over breast cancer. Create and name your own personal healing team. Choose who you want to be your cheerleaders as you cheer yourself to victory. Ask spirit to work through the chemotherapy, radiation, and the surgeon's hand. Remember, claim what you want to see in your reality. Everything is well. You are well. I mentioned about your medical team, your healing team, God working through the chemo. You have to be your own cheerleader. If you're sad, it's okay to be sad, but don't stay. Don't stay in sadness. You get to design your life right now, and it's a perfect opportunity to do so. Self-care is the best care. We're going to move forward to the next slide. Self-care is the best care. You get to cultivate a new relationship with yourself. I don't know what that looks like. So that may take some meditation time, some quiet time, some counseling, a life coach. I had a life coach throughout the whole experience. And she whipped me up in shape, and she pushed me even when I didn't feel like it being pushed. She pushed and she witnessed me, and she helped be my midwife through that to birth a new me. This was a new birth. Chemo kills all the cells in your body, the good ones trying to get to the bad, or to the rogue, not bad, but to the rogue low vibrational cells. I had a lot of low vibrations going on in my body. And I tell you, it helped me to create and cultivate a new relationship with myself. And it's not over. I've had to cultivate and recultivate and rebirth myself many times over. And I'm going through a rebirth right here in this moment with you. You may not be able to see it here, but I am going through it, and I am still working through it as I give this presentation. What you want to also do is glam yourself up. Can we expand that slide a little bit? Yeah, thank you. You're going to cultivate your new relationship with yourself. You're going to glam it up. If you got to go through chemo, got to go to radiation, you want to glam it up. Staycations and vacations are great. Even if you can't afford to go out of town, you could do a staycation for a day. Spend a night at a B&B, a bed and breakfast. Be pampered. Go to the spa. Do what you have to do for yourself. Nature walks. I love nature walks. Get out into nature. It's a cleanser. You breathe in that air that life and those trees are giving you, and you give them back what they need in carbon dioxide. Journaling and coloring. Become like a child. Even if you think you can't write, even if you don't want to color, do it. Do it. It takes your mind off of it, and it also gets you moving. That's movement. And when you move, you shake things up. And then when you do that, ideas will come to you. You know what? Where did that come from out of thin air? No, you're moving. You're shaking up. You're stirring up the pot. The pot is you. You're stirring up everything so that you can get what you need to take care of yourself. restoration and renewal is key. You have to be restored, restore your body, restore your mind. And however method or means you do that, that's up to you. That's your decision. There's so many options out here available to you. Adjusting your mindset, shifting from the negative mindsets, the negative people, taking yourself out of the environments that are poisonous, that are toxic for you. It's just not food. It's a mental diet, mental detoxification. It's an inside job. So we get to adjust and shift and embrace something new. Create a rebirthing ritual. Take baths, warm bubble baths, Epsom salt baths, pray in the bath, pray over the water. Water is life. If you pray, there are studies that show that if you speak negative to a bottle of water and you freeze it, that the icicles and the configuration of the water becomes distorted. You have water in your body. We're 80% water. The earth is 80% water. So you want to rebirth yourself. You want to speak to the waters inside of yourself and praise it. You want to affirm good and positive things. Self-care is the best care. So you have to take care of yourself. You get to take care of yourself and be gentle with yourself. Give yourself grace. Give yourself grace. You deserve that. You deserve that. So create that rebirthing ritual and ask, what does that look like? Vision boarding. What does that look like? What does my life look like now? So all we have is now, and you have the power of that right now to shift and rebirth your life. Next slide, please. 254,744. In 2018, women diagnosed that amount, 254,744 women were in 2018 were diagnosed in the US with breast cancer. That's a lot. More than 42,465 women passed. There was an increase in new cases over 10 years in 2018, and death rates, of course, were among the highest in Black women. Why? Because of late catches. You want to be proactive about breast exams and getting our buddies and those people who help us to move forward in health and wellness to help support that. So we won't have to have those late catches. Mammograms are great, but most women catch their own cancers themselves. So when you find something that's abnormal, please go. If you're afraid, which I know I was afraid too, you got to bring a girlfriend along. You do, or someone who you can trust. Next slide, please. Early detection saves lives. Yes, you got to feel the boobies every month or allow a trusted bosom buddy to hold you accountable to yourself. Yes, I feel my breasts all the time. And, if you're in relationship with someone, a husband or a wife, men get breast cancer too. Whatever your liking is, allow them to become familiar with your breasts. It's okay to have a partnership, so because other people may be a little bit more tactile and their fingers may be a little bit more sensitive and they can sense some things and feel for you. But of course, we take responsibility for ourselves. And that picture right there with those pink pumps on was my last day of radiation therapy. Ding-a-ling-a-ling, I'm ringing that bell. It was over, it was done, and I was so happy. Next slide, please. Another quote from my book, the choice is yours to make. You have dominion and power over the choices you make. Follow your instincts. Don't allow fear to drive you to choose something you don't want. I'm going to repeat that. Don't allow fear to drive you to choose something you don't want. There's so many options and so many roads to healing. Don't always take the first, but if you feel in your heart of hearts that this is the right move, then take it and trust yourself. Trust yourself, trust the process, and know the truth. The truth is whatever you believe and whatever you desire and whatever you want. That is the truth. No one else can tell you the truth. Only you and God know the truth. Only you know what's best for you. Next slide, please. Living and thriving beyond a breast cancer diagnosis is possible. Yes, it is. The gateway of healing is open and available for all who ask. I put that on there, for all who ask. You have to ask for it. You got to want it. You got to know that you're worthy to ask. You're worthy. Walk through that. Walk through the gate. Claim your healing and know it for yourself. It'll make a world of difference in your life. Believe me, trust me. Trust me, trust yourself. Next slide, please. Well, here's to breast health and wellness on this October 30th, 2021. Oh, I'm so happy to be here. I just want to thank you all so much for this opportunity to share with you my story, how I overcame, and how I'm still overcoming, how I'm still implementing best practices, how I still fail, how I still miss the mark, how my diet may not always be the best, how I love wine. I do. Balance is key. And, being easy and being patient. We don't always get it right. However, once you make a commitment to yourself, you'll do whatever it takes to move things out of your way that are not for your highest and best good. So you can reach me at freemangeneration@gmail.com. I am a podcaster. The name of my podcast is She Lives Free Podcast. It's on Spotify. And you can reach me on Facebook. You see the link there. And also on Instagram at Because She Lives on Instagram. And also my link is also in my bio on Instagram and Facebook. And you see the link there. So that concludes this talk for today. I really appreciate you. And thank you so much again, Portia, for allowing me to speak to you, your listeners.
Oh my gosh. Thank you so much for being so candid with us and so open with us about your story. It comes from a sense that you can tell all the passion in behind it, that, to urge others to, to stay the course and knowing that they can survive breast cancer and not just taking one opinion for fact and just going with that. Your passion to seek other alternatives to other opinions to live. Is inspiring. And I thank you for sharing that with us. I wanted to ask you, and I probably I missed this.
Mm-hmm.
At what age did you feel that lump? I don't know. You may have said it and I just missed it when you were talking.
I didn't mention it. I'm 54 now, so subtract 11 from 54. I was 40. I think I was 41. So it happened after my first mammogram.
Wow. So the mammogram did the mammogram not catch it?
You know what, Portia? I have so many theories in my head. I honestly believe that it happened after. I got my mammogram. I got my first baseline at 40. At 41 is when I felt the lump. So it had to have happened. I think I was working on breast cancer for a long time. To be honest with you, intuitively I had, because I was under so much stress when my husband was diagnosed, and he passed away quickly, 13 months, and I saw his decline, and I internalized it. He was the breadwinner. He was the person that took care of everything. Yeah. So when that happened, I'm thinking we're planning to have a family at the time, and it didn't happen. So I was angry about it. I was angry that he didn't fight. he had free will. You know what I mean? Everybody has free will in life. They could choose whether they want to stay or not. So I guess he just did not want to live that way. And it was very debilitating. So I believe the grief that I did not address hurt my heart. And it penetrated me on a soul level.
Mm.
And I didn't seek help because I was being that strong Black woman.
Yeah. Yeah.
What the heck? What are you doing?
No. Yeah.
Yeah. So I believe I worked on breast cancer for a long time. And then I was in a stressful relationship at the time. It was so toxic to me. That's another story for
Yeah.
another time.
Yeah.
But we as women have to be very selective and careful who we allow in our environments, in our physical environments, in our personal, intimate spaces. You know what I'm saying?
Yeah.
You just can't allow anyone inside, especially if you're a sensitive person, an empathic person, because a lot of healers are sensitive, they're very empathic, they can feel things. So if you're not protecting yourself, if you just allow everyone, you don't have boundaries. See, this experience has taught me and is still teaching boundaries to this day. That's why I say breast cancer was my teacher. I had to say hell no, because I was the ultimate people pleaser. So when you're pleasing other people who don't give a about you, you take it back.
Internalizes that. Yeah. Yeah.
Yeah. So
I remember I know you mentioned you had estrogen dominance, and I think, you know, in our earlier show, in our Mythbuster show, the doctor was talking about how hormonal imbalance is also, you know, a risk to breast cancer, and that also, you know, stems from like stress, like the things that you were saying, you know, impact your hormones and different things like that. So, it was interesting to, you know, hear that that's something that, you know, affected you. That is something that you saw could have been, you know, one of the risks, one of the signs that put you at risk of getting breast cancer. So,
no family history, Portia.
yeah.
No family history. Because of my diagnosis, I found out my oldest sister, she didn't tell anyone that she had breast cancer.
Your older sister. Oh, wow.
Yes. She since passed away because it returned. The cancer returned. So she passed a few years back, but there was a certain amount of time before the first occurrence and the second one. So there was no family history. So now I'm wondering, is there a family history? I don't know. I didn't take the BRCA test to find out.
Okay.
I just figured, you know what? I think stress and lifestyle created the cancer.
Oh, yeah, absolutely. Absolutely. Well, again, Tanya, as always, thank you so much for sharing. Thank you so much for being with us. You were wonderful and inspiring, and I'm just like thinking about myself. I'm like, oh man, I need to, you know, make sure that I'm, you know, doing more about knowing my body and feeling and checking, because as you mentioned, a lot of times you know, see it first, you know. You know, so we can definitely take matters in our own hands,
Yes.
and be our own health advocate. So thank you again, Tanya, and appreciate all your support.
Thank you, love. Thank you, Portia. Appreciate it.
All right. All right. Well, thank you to all our presenters. All a lot of our presenters again are Black Girl Health members, and I thank them for being a part of the family. Our presenters host our workshops. They educate our community, our women, and trying to, you know, improve the health of Black women. And I so thanking them for being a part of our family. If interested in becoming a Black Girl Health member, please register, sign up at membership.blackgirlhealth.com. It's right across the screen. You can register. Again, as mentioned before, we're coming out with our new app pretty soon this month. And our app is going to be our whole membership, where people will have all different types of features. They'll be able to book professionals when our app launches. They'll be able to participate in live events from our different professionals, podcasts, all that good stuff. They'll be able to participate right on the app. They'll be able to join different clubs, different health clubs right on the app. They'll be able to meet up with the different people for runs, walks, and all those good stuff. So there's a lot of different features for women on this app, for the Black Girl Health app, when it drops this month. If you want to be notified of the app, if you want to be notified, please complete the survey. We have been posting the survey during this whole series on, obviously the workshops. If you, we want to hear your feedback. And then also on the survey, it will say, if you want to be notified, give us your email. So then we will notify you so that you can download the app. So please make sure that you complete, that survey. And also, as we end our workshop series, I hope that you guys have been jotting this down, because I've learned a lot. I mean, we heard from a survivor. We talked about holistic prevention through like food and nutrition. We separated myths from facts today. So I hope that you learned a lot about breast cancer as we end the month of Breast Cancer Awareness Month. I would like to thank our sponsors, MD Anderson Cancer Center. Thank you so much. Touch, the Black Breast Cancer Alliance, so much for being a part of this program and this campaign. We could not have done this without you guys for sponsoring the event. So thank you so much. The last thing I want to make you guys aware of before we end our workshop series and enjoy the rest of your weekend is our 5K. So our 5K, I'm a Survivor 5K, is still going on. You have 2 days left, which is today and tomorrow, to participate in the 5K for breast cancer awareness. So a part of the 5K, all you do is register. Actually, in the comments, we'll put the registration link in the comments. It's in the comments, it's Black Girl Health Foundation .org/survivor, Black Girl Health Foundation .org/survivor. You can register still. You have 2 days left to register and participate in the 5K walk. That is 3 miles that you just walk on your own in support of breast cancer awareness, in support of breast cancer survivors. It's also on the screen here. We do encourage survivors to also walk with buddies and share their stories. So a buddy, a friend, and share your story and do the walk. So 2 days left to register. You can register here at blackgirlhealthfoundation.org/survivor to do your 3 miles anywhere. 3 miles. All right. So that is all, folks. I'm Portia Grigsby. Thank you so much for being part of our first I'm a Survivor workshop series. Have a great weekend.
What did it take for me to overcome breast cancer? It took the crucial first step of choosing MD Anderson Cancer Center. It took a unique multi-team approach and a comprehensive treatment plan so personalized that I trusted my doctors with my life. It took a deeper level of expertise to triumph over breast cancer and handle anything that comes my way.
What will we do in the pursuit of making cancer history? Whatever it takes.